last time also told, that there is a in rainy season, because of the cloudy weather and rains, change in the atmosphere, few people get cough and cold. But everybody doesn't get. Now all people are moving in the same atmosphere, or even during Corona, those people whose immunity was low, they got the infection. Now, the person who was also in that area, who also breathed in same air, he didn't get Corona. Why? Because his mucosa is strong enough. They fought with that bacteria, virus, coronavirus, and they killed them. So they didn't get it. So if you make this mucosa strong enough, it will kill the bacteria or virus, and you will not get allergic response. Allergy is what? It is a body response to the foreign material.
So continuous practice of pranayama will help.
Yeah.
To eradicate.
Yes, definitely. I think, again, I will give the same example. I think in the scientific basis of yoga, I have given this example. I used to go to different places for giving lecture. So one place I went, place. So my classmate came to receive me. So he was sneezing and running nose was there. I said, "What is happened?" No, I got little sore throat and URI. So there was the atmospheric change. So I got it. I said, "Okay. Are you taking anything?" He said, "Yeah, I've taken medicines and it will be okay in 2 days." He was with me for the lecture also. Then I came back in one day to Mumbai again. Again, after 6 months, again I went over there. And again I was having lecture over there. So same friend came to receive me. That time again he was having fever, sneezing and running nose. I said, what is, again you are having sneezing or running nose. What is this? You have the cough and cold for 12 months or what? 12 महीने तुझे सर्दी रहती है क्या? तो बोला नहीं, मुझे सर्दी सिर्फ 2 बार होती है साल में. एक बार हो गई तो 6 महीने रहती है. So whole year he has got a cough and cold or running nose. Then I said, okay, you practice this Kapalbhati and Ujjayi. He started practicing that, and after 6 months, he didn't have the problem of running nose and cough and cold or upper allergic rhinitis. Why? Because he started practicing. So in 6 months' time, the mucosa has become strong enough, so he didn't get the infection.
Oh, sure. Thank you.
Right. Anybody else? Any disease you feel that I have forgotten to cover of respiratory disease? You came to across some of the patient which was a respiratory problem and I have not covered it. If you know, please let me know so that it will be beneficial for all.
Sir, I've got a question.
Yes.
COPD, you said the lungs get extended and the diaphragm comes down. So will the diaphragm hurt their intestine or the lower part of the organs?
No. It will restrict the movements of the intestines. So because if diaphragm is up over here, intestines have got space to move. If it has come down permanently for more distance, the intestine, they will be compressed. If they are compressed, they will not be able to relax or dilate and expand and contract. So their motility will be hampered, their function will be hampered. So what is the function of intestine? Digestion will be hampered. So they will have digestive problem. Long run of time.
Yes, sir.
Sir, for people with sinus problem, the phlegm will be very hard and it will be inside the lungs from a very long time. So those people, it will be just accumulated inside. So for them, Jalaniti and steaming, is it okay that can we suggest those things?
What is your question? First, what you said, in which case you said?
Sinus.
Sinus. Now, what happens in sinus? the opening of the sinus into the nose is blocked. That is why there is collection into the sinuses, which is not coming out. But there is no collection into the lung. It is only into the sinuses. Now, if you are able to open the sinuses without surgery, what we said in surgery, what we do, we put a metal tube from here and puncture that wall. But here, by doing Jalneti and Kapalbhati and Ujjayi, if you are able to open these windows, slowly this will drain out and you will get relief from sinus. So Jalneti, Kapalbhati, Ujjayi and Brahmari, that will help him to improve the sinus condition, and slowly they will drain out and they will become clear.
But maybe in a very bad situation when he had several operations here in the nose, but still it is still continuing, and it has sometimes it forms inside, and it is very hard. So in those kind of situations,
What becomes hard?
the phlegm.
Legum.
Yeah.
See, it will not become hard because this window is closed, and the mucosa of this sinus is always secreting some fluid. Normally that fluid secreted, it cleans the walls and throws out through this window opening into the nose. But the opening is blocked, so water collection is inside. It will not become dry. It will remain wet only because continuously mucosa is secreting some liquid. Na? When it will become dry, when it is exposed to the air. So here there is no question of becoming dry. It will remain like that.
Okay, sir. I'll check with him. It is some kind of problem, maybe multiple other problem, maybe.
Yeah, if he is repeated operated also, that's why I said for sinus there is no 100% relief in yoga, in allopathy. But if you practice yoga, it will get cleared. So suppose he has been operated either for deviated nasal septum or puncture of the antrum. Still, if he practices yoga, he will not get a recurrence.
He will not.
वापस नहीं होगा उसको ऐसा.
Okay. Thank you.
यदि आपके पास कोई ऐसा पेशेंट होगा तो उसका क्या ऑपरेशन हुआ तो मुझे व्हाट्सएप पे भेजो, देन मैं आपको और ज्यादा क्लियर आइडिया दे सकेगा कि इसमें क्या करना.
Yes, sir. He has other problems also.
Like
Allergy and tube TB. TB has reached in the back spine. So
what?
TB, tuberculosis.
Tuberculosis. Okay.
So I will check with him and I will let you.
He might not be having much of the sinus problem. All the symptoms must be because of the tuberculosis.
Maybe, yes. I don't know about it. But he's been suffering from allergy from childhood and sinus also from childhood. TB he got later on in his life.
So now all problems are because of tuberculosis. But initially, and that's why in our study also last time I told, those people who are exposed to the dust, exposed to the different floor mill person, they are inhaling that आटा का जो बारीक बारीक microparticles रहते हैं, so they are likely to develop tuberculosis. So this is a aftermath of that.
Yes, maybe. So I will check.
Now he has to take complete treatment of tuberculosis, and then you can start him giving yoga practices. See whether he is sputum positive or negative, whether his lung is too much destroyed. Now you have seen the X-ray. So if that patient also has got X-ray, just see how much lung is destroyed.
Has to get detailed analysis only. Better to consult doctor personally. We cannot see.
Yeah, see his reports. If you are not convinced, show me it. show it to me. I will tell you what to do.
Okay, sir.
सर मेरी एक क्लाइंट है ना, उसको हर टाइम भस्त्रिका करने के बाद बहुत सारी छींक आती है।
बहुत सारे
छींक आती है मतलब
कितने बार आता है?
ऐसे 2-3 बार तो होता ही है, लेकिन एवरी डे
हाँ ठीक है, लेकिन बाद में कुछ नहीं होता है दिन भर।
नहीं।
हाँ तो don't worry about it. That because of the Brahmari, that opening must be getting opened up, and then if water dust particles are inside, if they are coming out, they will be foreign particle in the nose. So he may get sneezing, which by sneezing they are thrown out.
Okay.
So one more question. Sorry.
Yes.
One more question. Is there any specific test to check the health of lungs apart from X-rays?
Pulmonary function test, PFT.
PFT. Okay.
That will give the perfect idea whether his lungs are functioning properly, lung capacity is good, his expiratory volume is proper, his inspiratory volume is proper. All the things you will get from PFT.
Thank you, sir.
I will add one more 2 slides on PFT next time. Good. I will add it. PFT explanation will be there.
सर मेरी एक स्टूडेंट है, उनको प्राणायाम करते करते इतनी उबासी आती है, वैसा ही
आता है?
उबासी आती है, यॉर्निंग।
कौन सा प्राणायाम करते हैं?
सर ये भस्त्रिका, कपालभाति, जनरल प्राणायाम का क्लास है, उसी में तो वो सारे टाइम यॉर्निंग होता रहता है।
क्रिया करने के बाद होता है कि पहले होता है?
नहीं, जैसे बीच में ब्रेक रहता है ना, तभी करते करते भी रहता है, और बीच में जैसे ब्रेक रहता है।
Doing more than expected. भ्रामरी कितने बार कराते हो?
भ्रामरी भी कराते सर, और ये 5 to 10 times.
If it is done vigorously with force, sometimes it may happen. तो थोड़ा कम करके देखो. Whatever she is doing, just reduce the number of it. Suppose कपालभाति 100 बार करते तो 60 times करते, 60 times करते तो 40 times करनी चाहिए. Whatever rate, whatever the amount of practices she is doing, try to reduce it. Give little break in between 2 practices, and then see.
So this is the reason why this is yawning happening, sir. Our Bogle sir only told me this, Dr. Bogle from Keveledham. कि क्या करते हैं हम लोग क्रिया सब दे देते हैं, whatever कपालभाति, भस्त्रिका क्रिया देते हैं, but we don't give more of अनुलोम विलोम प्राणायाम. When is the person yawning? Because he's deficiency of oxygen, no? That sir will explain to you better. So आप लोग क्या करते हो? आप लोग अनुलोम विलोम 5 ही राउंड लेते हो, बिकॉज टाइम नहीं है क्लास का, 45 मिनट का क्लास है, एक घंटे का क्लास है, आप ज्यादा वो भस्त्रिका और इसमें ध्यान देते हो कपालभाति. एज सर सेड नाउ, वो उसको कम करो, 30, 40, 60 जो भी, उसको कम करके अनुलोम विलोम प्राणायाम के ऊपर ज्यादा स्ट्रेस टेक मोर अनुलोम विलोम प्राणायाम.
And also give break in between 2 क्रियास. तुम फटाफट एक के पीछे दूसरे के पीछे तीसरे करेंगे तो उसको रेस्ट मिलता ही नहीं है ना. That's why then he starts yawning.
सर नहीं, ब्रेक देख के ही कराती हूँ, पर पता नहीं.
That may not be sufficient for that particular person.
एंड क्रिया रिक्वायर्स ब्रेक. क्रिया के बाद कंप्लीट उसका ब्रीदिंग नॉर्मल होना चाहिए, देन यू गो फॉर द सेकंड प्रैक्टिस. तो मिनिमम 5 मिनट्स तो लगता ही है फॉर अ हेल्दी पर्सन. बीमार आदमी है तो फिर उसको और टाइम लगेगा उसको ब्रेथ कंट्रोल में, ब्रीदिंग कंट्रोल में.
अभी हम कपालभाति के 3 सेट करने के लिए बोलते हैं, isn't it? तो पहला सेट होने के बाद क्या बोलते हैं? वेट फॉर 2-3 minutes, लेट इट कम टू नॉर्मल, देन यू डू सेकंड सेट. अभी तुम गड़बड़ में 45 मिनट्स में सब करने का, चलो पहला सेट हो गया, चलो 2 बार ब्रीथ लिया, चलो दूसरा सेट चालू करो, तो ही विल गेट टायर्ड. और यॉर्निंग का दूसरा मतलब क्या है? इफ यू आर गेटिंग बोर्ड, यू गेट यॉर्निंग. सो हिज बॉडी गेट्स बोर्ड बिकॉज ऑफ योर कंटिन्यूअस ऑर्डर्स.
सर उनको ओएडी भी है, तो वो रीजन तो नहीं ना, ओएडी भी है उनको, ऑब्स्ट्रिकल ये एयरवेज डिसऑर्डर, ओएडी, ऑब्स्ट्रिकल ऑब्स्ट्रक्टिव or airways disorder.
That's COPD only, na?
हाँ,
So,
हाँ, उसके
definitely
कारण भी हो
his
सकता है.
capacity has already gone down.
One down.
और तुम उसको तुम्हारे हिसाब से करने के देंगे तो he will be definitely getting tired. It is like whipping a tired horse.
Always teachers remember, all yoga teachers, when you are giving practice, अगर आसनास का दे रहे हो ना तो उस दिन थोड़ा आसना ही दो, थोड़ा सा अनुलोम विलोम प्राणायाम भ्रामरी करो, छोड़ दो क्लास में. नेक्स्ट डे व्हेन यू आर टेकिंग कम आसना लो, प्राणायाम के ऊपर ज्यादा ध्यान दो. ऐसा करो, सब कंबाइन मत करो, बोलने का मतलब.
The
So ये
answer,
तो सिर्फ प्राणायाम का ही क्लास था.
but the answer is hidden in your question itself.
Question itself.
That when you said that he has got a COPD, that means his lungs are already damaged. His
Damaged.
capacity is already gone down. If you do PFT, pulmonary function test, you will find his values will be nearly 50% of a normal person. अभी ऐसे पर्सन को आपने बोला चलो 50 बार कपालभाति करो तो वो तो टायर होने वाला ही है, तो यार्निंग चालू करेगा वो.
नेक्स्ट
So
टाइम
that's why I said all everything बलपूर्वक करेगा तो बलहानि होगी, पहला प्रिंसिपल. दूसरा प्रिंसिपल, गिव इट एज पर द इंडिविजुअल कैपेसिटी. यदि वो ब्रेथलेस होने लगा, थक गया, ऐसा लगा, यार्निंग करने लगा, तो रिड्यूस द क्वांटिटी.
ओके सर, थैंक यू सर, थैंक यू सो मच.
Let us start new system now.
Yes, sir.
We will go to the cardiovascular system disorders. In this, first is the hypertension, that is a high blood pressure. अभी hypertension बोलते हो तो it is the increase in the blood pressure range. So we should know what is the normal blood pressure. So normal range of blood pressure, the normal blood pressure, if it is to be recorded on the paper, it is 110/70. 110 is a systolic blood pressure, 70 is a diastolic blood pressure. Now range कैसी रहेगी? So up to 140 systolic is a normal, and above 90 will be diastolic, will be called high BP. So 140 to 140 is a range, normal range. 110 is the lowest limit of the normal, and 140 is the highest limit of the normal. So 110 के नीचे गया. So just now somebody was telling that her BP is 100 only. For ladies it is 100 allowed, but for gents it is usually 110/70. But still, if he has got 100, it is not much problematic. But if it goes below 100, then you should worry. In females, if it is 100, it's okay. But if it goes below 85, 80, then you should worry. क्या रे वो मेरा blood pressure बहुत कम हो गया. Now 70 जो है diastolic. If it is 60, doesn't matter. If it is 80, okay. If it is between 80 and 90, that means you are likely to get blood pressure in future. And if it is 90 or above 90, that means you are a 100% candidate for high blood pressure. So remember, normal it should be 110/70, but it is not fixed range, fixed figure. If it is 130, okay, it is normal. If it is 140, you are on the verge of getting blood pressure. Similarly, diastolic also you have to measure. So these are the normal reading that you must know. Then what are the common causes of high blood pressure? Now, common causes, the first and foremost important is a mental tension. And 21st century is called century of tension. So everybody is getting tension. And hypertension, the tension plays major role. Again, I will explain lifestyle disorders, diabetes, blood pressure, then heart attack, asthma. They don't have any bacteria or virus. They are caused by mental tension. Then second is obesity. Whenever there is obesity, the fat deposition is more all over the body. Heart has to work more to supply the blood to all these extra parts of the body. And that is why obesity patient slowly he lands up in high blood pressure. Then lack of exercise. If you are doing exercise, your muscles are flexible. The flexibility of the body is good. Now muscles are there in each and every organ of the body. Also into the blood vessels, artery and vein. The wall of the artery is made up of muscles only. Because of the contraction of that muscle or relaxation of that muscle, the artery contracts and blood is pushed ahead. So lack of exercise, what will happen? It will reduce the flexibility of the muscle. And if the flexibility of the muscles of vessels is also reduced, then the flow of the blood will be slow, and then heart has to work more to pump the blood to the different parts of the body. Then aging. As age advances, the vessels, they become slowly rigid. The elasticity of the vessel reduces. What will happen? Suppose this is the heart and it is pumping blood. Now this is the tube. Now when this blood flows through this tube, if this tube is elastic, it will not offer his resistance to that blood coming out from the heart. So suppose this is a tube, elastic tube, and heart has pumped the blood. Now this blood, when it will come into this vessel, it will expand as per the need of the quantity of the blood. So there will not be resistance. But if this vessel is rigid, the wall is of metal, what will happen? Suppose this is a wall of the metal, metal wall of the vessel. The blood is pumped in. When it comes into the vessel, it will feel the resistance because this wall will not expand because of the blood coming out through the heart. So what will happen? Heart has to use more pressure to push this blood ahead. So as age advances, the elasticity of the vessels reduces, they become more rigid. So heart has to push the blood with more pressure so that it can reach to the distal part. पैर के उंगली तक, हाथ के उंगली तक ब्लड पहुंचना है ना. हार्ट यदि वीक होगा, यदि वो जोर से पंप से नहीं करेगा तो पैर के टो तक या उंगली तक ब्लड नहीं पहुंचेगा. So then what will happen? Heart has to do the function so that blood will reach to the all this distal part of the body. So it will start pumping with more force, and that is how the blood pressure increases. Have you understood this mechanism? If any doubt, please ask. Should I go ahead? You understood the mechanism of this, how the blood pressure increases as age advances. So I take it for granted that you understood the thing. So next is the kidney disorder. Now kidney secretes some hormones which are acting onto the vessels and heart. Angiotensin 1, angiotensin 2. Now these hormones, they act on the vessels and heart. So if there is any kidney disorder, these hormones which activate the heart, they increase, and that is why the heart rate increases. So blood pressure is directly related with the kidney functioning. इसलिए जो diabetes का patient होता है, so slowly as diabetes has got effect on all organs of the body, like if it is on retina, he gets blood vision. If it is on the heart, coronary arteries, he gets the silent heart attack. If it gets on the kidneys, the kidney filtration hampers and kidney problems start, and patient has to undergo dialysis. So what is the moral of the story? That diabetic patient, if it is long standing for 15-20 years, is likely to develop blood pressure because kidneys are damaged in diabetes. So these are the common causes. Now, as this is not because of any organism, bacteria or virus, we cannot give any medicine to kill the bacteria, kill the virus. So what we have to do? We have to give some medicines which will block the messages coming from brain to the heart to work more. And that is why different antihypertensive drugs are there, which are acting, but then they have got their side effects also. Now, once diabetes blood pressure patient is diagnosed, is a case of blood pressure. Now we'll go to that for a second. Then complications, cardiac failure, because heart rate increases, pulse rate increases, the heart is pumping blood with more pressure. That is why the systolic pressure. Yes, one more thing. What is systolic and what is diastolic?
सर सिस्टोलिक तो सर एट द टाइम ऑफ कॉन्ट्रैक्शन जो रहता है हार्ट वॉल
And what is
और
diastolic?
at the time of dilation of blood pressure
Dilatation.
towards the wall
This
of
is, yeah, correct. You are right. This is the heart. If it when it is contracting, the pressure used to contract to throw the blood out from heart to the vessel is the systolic pressure. Now, when heart is relaxing, that time what happens? The water blood has gone up. The area has become see when these ventricles are contracting, this left ventricle when it is contracting with the force, that blood is thrown out through the aorta to the whole of the body. So the pressure used to throw out this blood through this left ventricle is the systolic blood pressure. Now this blood has gone out. At the next time what happens, next moment what happens, the impure blood comes from both these things into the right atrium and these walls open up. Then this blood will come over here and the blood which has gone from here, this first I will explain you the circle and then I will come to the, now these are the impure blood vessels. This is superior vena cava, this is inferior vena cava. Whatever impure blood from all over the body above the heart level will come through the superior vena cava to the right atrium. The below the part of the heart, the blood from all over the part of the body below the heart will come through this inferior vena cava into the right atrium. Now this is the impure blood, deoxygenated blood, more of the carbon dioxide is there. Now this blood, when this wall opens, it enters into this ventricle, right ventricle. Then when this contracts, this blood goes through this pulmonary artery into the lungs where it is purified. After it is purified, this blood through this vein come into the left atrium, then it comes to the left ventricle, and when left ventricle contracts, this blood goes through the aorta to the all over body. Now, this is the impure blood. This is also impure blood, and it goes through this. It is called pulmonary artery. Why it is called pulmonary artery? Though it is containing impure blood, artery contains pure blood. Na?
No, sir. Artery means the vessel which takes the blood away from the heart, and veins means the blood vessel which brings in to the heart. That is the
yeah. So anything going out from the heart is artery, which is coming inside the heart is the vein. Now this blood is going out, but this is the impure blood. But since it is coming out from the heart, that is why it is called artery. So these are the exceptions to the rule. Now this is a pulmonary vein, but it contains the oxygenated blood. Okay. Now this thing you have understood. Now we'll come to the contraction of the heart. The contraction wave starts from here. And first both the atrium contract, right atrium and left atrium. When they contract and these walls open up and these walls they keep closed. So listen and understand the action properly. The wave of the contraction of the heart starts from here. So these two, left atrium and right atrium, they are compressed. At the same time, these walls open up and these two walls, they get closed. So the blood will enter from right atrium to the right ventricle, from left atrium to the left ventricle. Now, as this contraction wave passes down over here, when it comes over here, what will happen? Now, both the ventricles will contract. Now, when both the ventricles will contract, these two walls will close first and these two walls will open up. So what will happen? Blood from right ventricle will flow through this pulmonary artery to the lungs and through this aorta to the whole of the body. Now this time, if these walls will remain open, what will happen? This impure blood will go back here and this blood will go back here and it will cause a problem. So this is a synchronized action. When these two contracting, these two walls open, these two walls close. When both the ventricles are contracting, these two walls close and these two walls open up. So this is how the procedure of the heart functioning is going on. Now what we are discussing is the pressure used by the ventricle to contract. This blood goes to the aorta. So this is the systolic blood pressure. Now we have seen that wave, contraction waves have gone down and came up to here when both the ventricles were contracting, and the pure blood was thrown into the aorta, impure blood was thrown into the pulmonary artery. So the contraction phase got over. Now when contraction phase got over, both the heart is relaxing. So both the ventricles are relaxing. That time, these two walls open up and the blood enters through this right atrium into the right ventricle and from left atrium into the left ventricle. So this is called diastolic phase. So when heart is contracting, it is a systolic blood pressure. When heart is relaxing or dilating, that time the pressure is the diastolic pressure. So this is the difference between a systolic and diastolic pressure. Now, in measuring, the systolic pressure sometimes can increase when you are running, working more, when your heart is trying to work more to supply more blood. So little rise into the systolic blood pressure is not at all any problem. But if there is a rise in the diastolic blood pressure, then it is a patient of hypertension or high blood pressure. Now here you can see the range. It is 110 to 140. Those are 30 degree it can increase. But here it is only 70 to 80. 80 to 90 is a borderline and above 90 is a blood pressure patient. So the range is very low because dilatation of the heart, if it is taking more time and the pressure is increasing, that because if the pressure increases, then heart has to work more against pumping the blood. And that is why the systolic blood pressure is not that important, but diastolic blood pressure is more important to diagnose the case as a hypertension. Now, if this heart has to work more, so blood pressure goes on increasing, one day what happens? Heart fails. Or the ventricular muscle, they fail to contract because they become fatigued, and that is called cardiac failure. Then second complication is a heart attack, and third is a stroke. Now, heart attack when happens? Because the artery gets blocked because of the thrombus. When heart is forcing the blood with more pressure, if there is some atherosclerotic plaque, it can get dislodged and it may go into the coronary artery because coronary artery is here. This is the coronary artery. Now, if it contracts with vigor, force, and if there is any thrombus into this blood, it will go through this and it may come into the coronary artery. And if coronary artery gets blocked, then patient may get heart attack. Then third is the stroke. Now, stroke causing paralysis. Stroke का मतलब जो है, when the blood supply to the heart reduces, either patient will feel fainting or confused. Now, the heart see, this is the heart. If it is pumping with force, if the heart blood pressure has increased, now this is straight vessel going to the brain, isn't it? And this main vessel, big vessel, when it goes, it branches, and when it comes to the brain substance, that time it is in the capillary form, very thin, delicate. Now, if this blood pressure increases, the small capillaries, which are very delicate at the brain level substance, they cannot stand the pressure and they give way. They burst open. And when they burst open, the blood collects into that part, and that blood causes pressure onto the brain, and the part of the body which is controlled by that pressurized brain, they get paralysis. So that is a stroke. Now, how the complication of blood pressure is a stroke, have you understood this? So I will go ahead then. So these are the three complications of cardiac failure, heart attack, and stroke causing paralysis. Now, what are the symptoms? Common symptoms of the blood pressure. The first is a